Children with medical complexities represent less than 1% of the total pediatric population in Canada, yet they account for 1/3 of all healthcare spending on children. We've had the opportunity to meet with several families of children with medical complexities. During one of our most memorable interactions, we learned about a little guy named Charlie. Charlie was born with a long-term medical condition that requires 24-hour care. He's on a ventilator and takes several medications each day. His mom tried to use a home care nursing service so that she could continue her full-time job, but after months of broken communication, she feared that it was only a matter of time before her son was accidentally given a double dose of a medication or the wrong treatment. She felt that she had no other choice but to quit her job. This situation represents more than half of families of children with medical complexities, meaning that nursing agencies are constantly losing clients. In the home, parents are expected to assume responsibility for care coordination. So, to communicate with their nurses, they often create a lengthy paper-based system that they'll ask nurses to record information into. But this can be cumbersome. So, some families and some nursing agencies have started using software applications to separately track information, but none currently bridge the communication gap for sharing this information. Stellar Care addresses this need. We've developed a mobile application that allows for real-time, two-way communication between family caregivers and home care nurses. We enhance communication by providing families with a more effective method to teach their home care nurses their best practices and expectations, organize their child's health information, but most importantly, to facilitate the handoff of their child's care in the home. Unlike all other mobile applications, Stellar Care is geared towards providing both family caregivers and home care nurses with the ability to access the information they need for the continuity of care. Current research at Sick Kids has identified severe consequences for families in response to the stress associated with caring for a child with a medical complexity. Further research is also looking into effective communication methods between families and nurses in the home. We've shared Stellar Care with family caregivers and home care nurses, and their responses have been overwhelming. So we plan to license our software to current nursing agencies, thus enabling them to provide this higher quality of care. Stellar Care has been developed by a close-knit group of biomedical engineers with expertise in software development, user-centered design, and human factors engineering. We are also guided by experts in the development of novel healthcare systems. We're Stellar Care. Join us as we brighten the future of childcare. Thank you.